Decker. I'm a registered nurse, and this is Nursing Analysis. And today we will discuss oral hygiene. Oral hygiene maintains the integrity of the mucous membranes and the teeth and gums. Daily mouth care, adequate nutrition, and routine dental checkups can prevent tooth loss and gum disease. We need to remove food and any particles and pulled secretions to keep our patient's mouth clean, as to prevent infections and promote a healthy appetite. We shall now briefly discuss the anatomy and physiology of the mouth, also known as the oral cavity. This hollow chamber contains a roof, a floor, and walls. During ingestion, food enters this chamber and the process of digestion begins immediately. The mucous membranes inside the mouth lubricate the food passing through it. The roof of the mouth contains the hard palate. This bony structure forms the anterior or front portion combined with the maxillary bones. The rear portion of the roof of the mouth is made of the soft palate. It has been labeled as soft related to its muscular consistency. In the center of the soft palate, the cone-shaped uvula resides. Together, these structures prevent food and liquid from entering the nasal cavities. The floor of the mouth contains the tongue and the muscles that operate its movement. The tongue is anchored to the floor by a thin membrane called the frenulum. Let's now discuss the teeth. The tooth is divided into three main parts: the crown, the neck, and the root. The crown is the visible portion. This is covered by the hardest tissue in the body called enamel. It is also made up of dentin and cementum. All three of these layers are at risk for dental caries, which can form permanent cavities in the teeth, causing them to become damaged and or lost. The periodontal membranes line each tooth socket and anchor the tooth to the bone. If the gums, also known as gingivae, become inflamed, this condition is known as gingivitis, and if not treated, can lead to periodontitis, which can cause loss of both the membrane and bone, which can contribute to the loosening of the tooth and complete tooth loss. This condition is the leading cause of tooth loss among adults. We shall now discuss the salivary glands, the accessory glands of digestion. The parotids, submandibular and sublingual, which produce 1 liter of saliva a day. Within this saliva, the enzyme amylase can be found, which begins chemical digestion of carbohydrates. Assessment of the oral cavity begins with asking the patient about usual hygiene practices, about any tobacco or alcohol use. We will also include any reports of family history of disease. Inspection of the lips, oral mucosa, gums, tongue, teeth, and mucous membranes, which should be pink and moist without lesions. We need to check for any loose, missing, or decaying teeth. Tartar and stomatitis. We need to note any halitosis, which is unusual odor, and check the tongue for alignment, color, movement, and any lesions present. Let's now discuss patient education for preventing caries and periodontal disease. We will educate the patient to eliminate between meal snacks with high sugar content, such as ice cream, soft drinks, candy, gum, jams, and jellies. We need to include in the diet cleansing fibrous foods, such as raw fruits and vegetables. Include an adequate intake of calcium, phosphorus, and vitamins A, C, and D. We need to have regular dental checkups every 6 months. We will brush the teeth with a soft brush and toothpaste after each meal and at bedtime. Bacteria do the most damage to the teeth in the first 24 hours after eating. We need to floss between the teeth daily to remove food debris and stimulate the blood flow to the gingiva. Use a fluoride toothpaste to strengthen tooth enamel. You can make your own cleanser by combining 1 part baking soda with 2 parts salt. Follow the dentist's recommendations for topical application of fluoride. We will now discuss brushing and flossing. We need to make sure the brush is small enough to reach all the teeth. If it is too firm, it can injure the enamel and gum tissue. Electric toothbrushes are effective. However, you should consult with your dentist about using water spray units because they can force debris into pockets of the gums. We need to brush at a 45-degree angle from the gum to the tooth crown, using small, circular, or vibrating motions. When flossing, wrap one end of the floss around each of your middle fingers. Hold about 1 to 2 inches of the floss tightly between the fingers. Insert the floss between the teeth by gently moving it back and forth. Do not force it. Floss adjacent sides of both teeth to the gum tissue, but not into the gum, because you may injure the tissue. Use a fresh section of floss when it becomes soiled or frayed. Rinse your mouth well when you are finished. Let's now discuss oral hygiene for children. Begin oral hygiene when the first tooth erupts. Use a washcloth, cotton ball, or gauze pad moistened with water. Do not put a child to bed with a bottle or sippy cup, milk, juice, or any other liquid with sugar, which can lead to dental caries in the young child when the liquid sits on the teeth at night or during naps. Begin brushing the child's teeth with a soft toothbrush. When they are about 18 months old, start first using water only. Later, switch to a fluoride-containing toothpaste. Let's now discuss denture self-care. If you have dentures or other removable prostheses, such as bridges, wear them. If you do not, the gums are likely to shrink and you will have further gum loss. Clean dentures and bridges at least once a day, preferably after each meal. Remove the dentures from the mouth to clean them. Use regular toothpaste or special denture cleaning compounds. Do not use hot water on dentures. It may damage them. If the dentures have metal parts, do not soak them overnight in cleaning solutions. Store the dentures in a denture cup in water to prevent drying. Do not wrap them in tissues because they may accidentally be thrown away. Clean dentures over a plastic pan or towel in the sink. They are fragile and may break if dropped. Clients who have fragile oral mucosa require gentle brushing and flossing. Remove the dentures with a gloved hand by pulling down and out at the front of the upper denture and lifting up and out at the front of the lower denture. A patient may have a complete set of removable dentures or just an upper or lower plate. A bridge or partial plate consists of one or more artificial teeth. A bridge may be permanently fastened to other teeth, or it may be removable. Artificial teeth are fitted to the individual and should not be used by anyone else. If the person leaves the prosthesis out of his mouth for long periods, the shape of the gums will change, and the prosthesis will no longer fit properly. Poorly fitted or loose dentures can lead to chewing difficulties and even nutritional deficiencies. We will now discuss oral care for critically ill patients. Patients in long-term care settings and critically ill patients in acute care settings are at high risk for healthcare-associated pneumonia. This is especially true for those dependent on a ventilator. Ventilator-associated pneumonia, or VAP, is the most common healthcare-acquired infection in critically ill patients. A simple and inexpensive way to reduce the risk of pneumonia for these patients is to keep their teeth clean, thus reducing the number of bacteria that cause pneumonia. This regimen includes the following. Brush the teeth at least twice a day. Utilize a soft toothbrush and moisturize the oral mucosa and lips every 2 to 4 hours. Use a chlorhexidine gluconate 0.12% and rinse twice a day during the perioperative period for adult patients who undergo cardiac surgery. Use mouthwash inside the mouth twice a day for adult patients who are on a ventilator. We will now discuss oral care for the unconscious patient. This is particularly important because they often breathe through the mouth. If the patient is receiving oxygen per cannula or has a nasogastric or feeding tube inserted, the mucous membranes become even drier. An unconscious patient often responds to oral stimulation by biting down. So use a padded tongue blade instead of your fingers to hold the mouth open. Also use a padded tongue blade when providing oral care for a patient with seizures to avoid the patient biting you. Follow agency practices for the type and frequency of special mouth care. Some patients may need it every hour or two. You may use commercially packaged applicators or foam swabs to clean the mouth. Do not use lemon glycerin swabs because they are drying to the mucosa and may cause changes in tooth enamel. Do not use hydrogen peroxide because it is irritating to the oral mucosa and may alter the balance of normal flora of the mouth. We must remember skills of oral care. Toothbrushing and denture care are appropriate to delegate after assessing the patient's gag reflex first. Instruct the UAP the proper way to position the patient. If the patient is unconscious or debilitated, remind the UAP to report any changes in the oral mucosa. We must remember to have suction equipment ready at bedside when providing oral hygiene to patients who are unconscious to prevent aspiration. We need to position them sideline with the head toward you in either semi-phallus position or with the head of the bed flat. This will allow fluid and oral secretions to collect in the dependent side of the mouth and drain out. Now it's time for one of our favorite subjects. It is our rhyme time review. Keeping the mouth fresh and clean is the duty of the nurse performing oral hygiene. We utilize intuition and provide adequate nutrition, scheduling our visits so the dentist can check, looking for disease to prevent and detect. The 3 layers of the tooth can easily be found from the root to the neck and on to the crown. The hardest tissue in the body, by example, made of cementin and dentin, this is enamel. We must remember to be wary. We must avoid deficiencies like dental caries. We need to be careful when we eat and avoid foods that are sweet. We need to keep the teeth shiny with a gloss and teach our patients to brush and floss. To not allow the toothbrush to dangle as we maintain a 45-degree angle. Utilize the water you dispense to give the mouth a good rinse. We must use censure when providing care for dentures. We need to check the water temperature a lot. Never clean dentures with water that is hot. To remove the denture from suspension, we pull down and out with tension. This is the drop for the denture atop. When removing the denture that is lower, we pull up and out a little slower. We must remember the critically ill and VAP and all of the microorganisms it can trap. Never do we rush as we use a soft toothbrush. We must make the pathogens go away as we brush the teeth at least twice a day. Remember to moisturize the mucosa like you are supposed to. We must prevent the microbe as it devours and provide oral care every 2 to 4 hours. Just remember the complete routine and the use of 0.12 chlorhexidine. Thank you for taking the time for learning with nursing analysis. Please show your support by clicking the like and subscribe button. As always, your support is greatly appreciated. And please feel free to leave a comment and give us any suggestions or ideas for future videos.
Learn how to perform new skills. Learn the knowledge to heal. Learn how to make a difference and save lives. At Medical Prep Institute, we can provide a quality education from knowledgeable instructors at an affordable price. Call us today at 813-932-1710 or email at info@mpied.com.